afternoon to everyone. Thanks to be here. I'm very honored to be here and share with you my experience with the CELLBOOSTER products. And of course, I'm honored to have with me two colleagues, Dr. Nenad Stankovic from Serbia. Then we talk you about the lower face. He's a big doctor in aesthetic medicine.
120 kilos. Just to be sure.
And then, of course, my dear colleague Timur Taskesen, that will explain you his experience in the treatment of the mid-face. Last but not least, I'm here, I'm Davide Rossi, I'm an aesthetic doctor from Italy, from Padova. And I share with you my experience in the treatment of the upper face, in particular in the periorbital area. As you know better than me, the chronophotoaging is visible, of course, in the periorbital area. And when time goes on, you can appreciate a decrease in sebum secretion, an increasing cirrhosis, a loss of muscle tone, of course, a reabsorption of the orbital fat, and last but not least, a loss of elasticity. So there is a great request for treatment of the periorbital area. But when you approach the treatment of the periorbital area, you have to keep in mind the anatomical complexity of the area, because there's a lot of vessel, vein, artery, nerve, so a lot of structure that cultivate the head movement. Speaking about anatomy complication, keep in mind that the eye movement are possible thanks to about 22 muscles. What's the anatomical feature of this complicated area? The eyelid skin is the thinnest of the human body. There are fewer sebaceous glands, fewer sweat glands, and less hair follicles. About thinness, try to imagine that the thin is lower than 1 millimeter, and in the sole of the foot is about 2 millimeters. So it's very thinner, elastic, and extensible. The periorbital imperfection that you can appreciate are skin laxity, the periorbital edema, of course, the dark circles. The skin, the periorbital edema is a reduced lymphatic drainage resulting in accumulation of fluid in the cellular space. Is not related to the age. I have a lot of young patients that suffer about periorbital edema. Of course, they are worsened by stress, by alcohol and food excess, allergies, irritations, sleep disorders. Okay, the dark cycles are due to the thinning of the skin that reveals the underlying vessel. Dark cycles, of course, are worsened by sleep disorders, eye fatigue, allergies, dehydration, and of course, overexposure to the sun. This is my choice. Since 2 years ago, I started to use the CELLBOOSTER product to treat the periorbital area. We are talking about a class 3 medical device, CE marked, Swiss made. It's a booster complex, injectable and stabilized of hyaluronic acid, amino acid, vitamins, and oligoelements, born from the patent CHAC technology. In a nutshell, what's CHAC technology? CHAC technology modifies and exploits the natural properties of hyaluronic acid in order to link amino acid and vitamins without use of any binding agent. This complex, so hyaluronic acid, vitamins, amino acid complex, is an optimal vehicle to transport these essential nutrients to the skins. In detail, we have two main phases in the CHAC technology. The first solid phases, and then a liquid phases. The first phases has two steps. In the first step, we have the high molecular weight hyaluronic acid matrix formation, a treatment of hyaluronic acid with vitamins, amino acids and peptides, and oligoelements. It depends on the formulation of the cell booster. This complex is understood to share the formation in a particular pressure, in a particular temperature, and particular resting times. So we have in the second step a mechanical mixture and linked specific complex formation. So the chain of hyaluronic acid are able to accept the nutrients that we put inside. The wick of the bonds is hydrogen bonds and van der Waals bonds. So there are no physical attraction among the hyaluronic acid chains and other nutrients. As you can see, integration of the components into the HA chains, formation of weak interaction that do a complex stabilization and protection. This is a supramolecular compost. After that, we have the liquid phase. We put a buffer, water buffer. So we have the rehydration of the 3D stabilized complex. So it became even more stabilized. So we have the protection of hyaluronic acid molecule without any physical bindings with amino acid, vitamins, and oligoelements. This is a video that resumes all we have just said. I don't know if the volume. Of course, the imaging is better than 100 words. You can see the stretching of the chain of hyaluronic acid that accept the oligoelements, vitamins, amino acid. After that, we have reduce of the pressure, and then we have a stabilized complex, and this is all family of cell booster. Glow, shape, lift, and air. And this is my 3 musketeers that I use in the treatment of the periocular area. As you can see, the name is lift, glow, and shape. And under each one, there is a brief resume of what they do. In the lift is indicated for skin intensification, lift and smooth wrinkles, and so overall improved skin tone and microcirculation. Glow, reduced hyperpigmentation, improved skin tone, and deeply hydrated skin. This is one of my favorite products because they protect the skin against environment aggressions. Last but not least, shape. This is active on local fat and double chin reduce, but also on liquid retention decrease, and it improves the lymphatic drainage. How to inject? As you want. You can use both needle or cannula. In the next slide, I will show you my treatment with cannula and with needle. Here we have a deeper explanation of the cell booster lift. As you can see, the indication, the treatment area, and in particular the composition. There are 18 milligrams of hyaluronic acid, vitamins, and amino acid that goes under the name of rejuvenating complex. So we have lift and smoothness wrinkle, skin redensification, skin tone, and microcirculation improvement. As you know, hyaluronic acid, and in particular high-grade hyaluronic acid, is essential for the extracellular matrix. The vitamins are essential for cell metabolism, and the amino acid, it depends on the type. Arginine, for example, is a strong antioxidant, a strong hydrating. Glycine and proline themselves represent 1/3 of the collagen. Lysine and valine are essential amino acids. So we only provide it by food. We don't produce ourselves lysine and valine. So we have After injection, an immediate skin effect with the dermis epidermis, hydration, and an improved matrix structure with an improvement of integrity and health. We have an action on keratinocytes and fibroblasts. So we have an improvement of cell metabolism, a renewed cells, and an improvement of energy and communication between cells. So we have a strong effect, antioxidant and anti-inflammatory. And this is a dermoscopy that show you the effect on the crow's feet with a reduce of 25% of the crow feet after the injection of lift. About claw, we have the indication, the treatment areas, and in this case we have, as always, 18 milligrams of hyaluronic acid, a pool of amino acid, and vitamins. So we can improve the skin tone, we can reduce, in particular, the hyperpigmentation, and we have a deeply hydration of the skin. As we have just already seen, the high weight hyaluronic acid is fundamentally essential for extracellular matrix. The vitamins are essential for cell metabolism, and of course the amino acid and peptides. In this case, we have the glutathione that has, as you know, an important antioxidant and lighting effect. Because we have a first effect of hydration on the skin, but in particular, glow is indicated for the treatment of hyperpigmentation. Because glutathione with cysteine is able to block the transformation of tyrosine in dopa and dopaquinone. So we block the cascade of dopamine. So we can prevent the insertion of hyperpigmentation, but with vitamin C, we are able to reduce the accumulation of pigmentation. And here you can see an image-based control of melanin after injection of glow. You can see the improvement of the skin tone with a lot of disappear of the skin spot. At the end, shape is indicated for local fat accumulation. As you can see, as always, we have 18 milligrams of hyaluronic acid, L-carnitine, and vitamin C. So we are able to treat the local fat and double chin, and in particular, we can reduce the retention of liquid. How does it work? It improves the transportation of lipid from the adipocyte to the mitochondria. So this is an action of L-carnitine and vitamin C. So we have a reduction of the oxidation. They work together with to allow a physiological reduction in fat deposit in adipocyte. The main thing is that this product is able to transform fat into energy in areas where it goes. If you want to compare shape with other technique using lipolysis, there is a big difference, for example, with PDC or DCA, because in this case we have a necrolysis, so we have an improvement of the pro-inflammatory substances that we liberated after the treatment, and with cell booster shape we transform lipid into energy. So we don't have any lysis. Shape, as you've seen before, is able to, with carnitine, hyaluronic acid, carnitine, and vitamin C, help lymphatic drainage and fight fluid retention. So it can support the lymphatic system to reduce fluid retention. And this is a demonstration with in the periorbital area with skin microlief after the injection of shape, before and after. Now we have two videos. In the right, we have a treatment with the needle, so the micro drops of lift. Of course, I start near the canthus, and then I go down and extend my action where does it's. The treatment is not painful if you have a good hand, and a good needle is necessary, absolutely. On the other hand, is a treatment always good with needle for the dark cycle using the glow. With glow, in my opinion, I don't know if my colleague are with me in this thought, but the more superficial you are, the more effective is the product with glow. This is another treatment with cannula. Of course, we don't have a feeling effect, but in my practice, after 2 or 3 treatments with cannula, in the theatre, for example, we have an improvement of the volume. I don't know why. I'm honest. I don't know why. Tell me why.
Skin redensification.
Yes, a lot of skin redensification, similar to treat with a filler. In this case, only to avoid any problem with vessel, I used a 22 gauge cannula that is very strong. But I usually use a 25 gauge cannula. As you can see, the treatment is painful. No pain, patient happy, usually. Okay. At the end of the treatment, you have only the whole. Okay. This is the problem that normally I do an intensive course treatment with a 2 or 3 week interval, and then in the support course, 1 treatment per month. Some clinical cases. This is a young man with a lot of problems about microcirculation. I use a lift in this case, but after that I use glow to improve the result. As you can see, I use a papula, injection angle 30 degrees, is intradermal injection. Volume injected 2 ml for both sides, and 32 gauge needle, and in total after 2 sessions. The left part is the same, of course. After that, but I don't have the photos, I treat all the area with glow with an improvement of the microcirculation. This is a lady where I use lift, micropapula, intradermal, as usual with 30 degrees, 3 ml for both sides. The result after 2 sessions. The other side, dermal improvement in this case is well visible in my opinion. This is a young lady with the dark circle. I did in the first session with cannula 1.8 ml, 0.9 for each side, with a 25 gauge cannula. And then after that, other 2 sessions with micropapula intradermal, with, of course with needle, 3 ml for both sides, so 1 vial in total. And the result is really appreciable. Another case, of course, with the needle, 2 sessions of glow, intradermal, 2 ml for both sides. My part is about the upper side of the face. In this case, I treat all the face with the glow, a total of 3 sessions, 3 ml for both sides per session, and the result is very, very, very good, with a great appreciation by the patient. This is a woman where I put together shape and globe with micropapula, an induction angle of 30 degrees, intradermal, 1 ml for both sides of shape and 2 ml for both sides of globe, with a 32 gauge needle. In total, 3 sessions, 1 of shape and 2 of glow. Sorry. After that, there was an improvement of the dark circle, but I don't have with me the photo. Last case, 1 ml for both sides of shape, only 1 session, and you can see the good result that we have achieved. Thank you for your attention.
Good evening to everyone, and thank you for being here. So I have the honor to talk about the mid-phase. You know, the mid-phase is like the foundation of the face. So our eyes age, and even as Dr. Davide already told you about, there are so many factors that are just like making this faster and problematic. But the mid-phase is something that we see a lot and that we have been treating since, I don't know, maybe 30 years already, since the hyaluronic acid fillers came out. So the hyaluronic acid is something that we use commonly in that area. So about the mid-phase rejuvenation. So it's just like something that is really something that we do all day long if we are practicing in the aesthetic field. And the fillers, mainly the hyaluronic acid fillers, are usually the go-to products when we address the mid-phase. But now it's just like the aesthetic world is changing slowly by slowly, because you know that patients are coming in asking for natural results. They are afraid of these overfilled filler syndromes, and now it's good that we can offer them something where we don't overfill them by using different kind of techniques, but also less products is needed if we can distribute the products in a different way. And by filling the mid-phase, it's something that we need to be a little bit more attentive about the assessment that we do. So usually when we talk about mid-phase aging, it means that the anatomical changes are in this area. So we have a loss of volume, we have a descent of the fat pads, the skin gets thinner, and also the ligaments get weaker, and so that's why our face is aging downwards. And to replenish that look, we usually start injecting in the cheek area, in the mid-face area, just underneath the eye, sometimes also filling the eye area. But I have stopped doing, for example, fillers in the under eye area, and that's why I'm happy that Dr. Rossi also is supporting that kind of idea for me as well, because I feel like if we put too much filler in the under eye area, in the end it won't have much of a natural result, and the people get swollen very, very often. So if you want to reduce the usage of the filler, then it's also really important that you understand the changes that we're going through. And I know this is something that a lot of brands are talking about, and about also the different kind of strategies, but we have to just know what are our treatment goals. And this is something where we need to talk also with the patient to define really successful outcomes, because in the end, if the patient is not happy with the results, then we need to address that, and this is really important. So we can restore the lost volume in the areas of the concern, but we need to also improve the skin texture. And for me as a dermatologist, I'm really happy that the trend is going in that way. So less filling, less overfilling, and more into skin quality. And this is where the product of Suisselle is just like coming in really, really fine. And you can see, I will also show you some techniques where we can also have lifting effect of the tissues by using different kind of techniques and angles with the products, even though they don't have a lifting capacity. So the non-surgical and surgical options for the mid-phase is just like really something that is common and that all the injectors are doing. So we start, for example, by certain points in the cheek area. We fill maybe in the mid-phase area. We fill the nasolabial fold, but this is something that has changed over time as well. So now we don't lose that much product in an area where we need to fill and fill and fill and don't have much of an effect. And now we are also thinking about more the movable areas. We are thinking about the toxins. So there are different kind of things that we are just doing. And what I like to do is that I also like to combine. So as a dermatologist, it's easy for me to do that because then I use the laser whenever needed. For example, in autumn time until winter, I like to use the radiofrequency microneedling. This is also something that has been on the trend since many years now. And the biostimulators are also something that you can use if you don't want to use the hyaluronic acid filler. And also like the PLLA, so the polylactic acid is also an option for you if you are familiar with these kind of options as well. The safety is really high with these products because there's, if you are trained, you know what you're doing and you know where you're placing these kind of products. So in a way, to make it a little bit more short, it's just like we need to find individualized treatment. So if we assess the patient, we know, okay, what do we want to achieve? So if we see the tear trough or if we see the dark circles around the eyes, we know what kind of product we can use, we know how we can address that. If we have a volume loss, we cannot address that with a cell booster, but we can set a foundation with a filler or with a biostimulator, and then on top of that get the best effect out of it by using the cell booster range. So this is really something that is really, really important. And the second key point is do it a little bit more age specific. So there's no one treatment that fits all of them. So it's otherwise we would all be Cinderella by fitting in that one shoe that is there. So in the end, it's just that really you have to do a preventive care in your 30s. You have to do a volume replacement and lifting in your 40s, and you have to structuralize the support in your 60s and beyond. And that's why it's really nice, and you also saw the results also from my colleague. So if you treat the full face, you will have a really, really pleasant surprise with the products, and you will see that the patient will also be adherent to you because you can deliver. So this is really, really something that is nice. And now with the new era of the facial aesthetics, it's just like we have a dynamic approach. We can adapt that. We can use less of the fillers, and we can still tailor a really nice result with that. And this is something that is really something outstanding for the company, so that we have just like a range that we can use. So it's just like playing the piano. So not only one tone will make the concert. So in the end, it's just like a composition of all of it. And so you're able to address different kind of skin needs by the Three Musketeers, as Davide just introduced you, the lip, the shape, and the glow. The hair is an outstanding product, again, for different kind of usage, to not in the mid-face part, but definitely for the hair loss. So these are the ones that you already heard about, so I'm going to go over that, so I'm not repeating myself. Also about the shock technology. It's always something that I learned now from different kind of presentations. It's always good to repeat it and to make sure that you know, okay, what is the shock technology? It's a stabilized complex without a binding agent, without a chemical binding agent, because you have physical laws that attract the vitamins and the amino acids inside of it. You have a better integration of the vitamins and amino acids because they use the high molecular weight hyaluronic acid as a cap, as a taxi, to go down and deeper in the skin, so to say in the cellular level. That's why they're not called skin booster, that's why they're called cell booster. And the other thing is that we have a supramolecular depot. So we have a different kind of a complex of the hyaluronic acid, which makes it also easier for the transportation, for delivery, and also for the protection, because this is what we want to achieve. We want to have a safe and good result, and we also want to be able to deliver that, and we can deliver this by using also with the assessment the right products in the right plane, and this is what we can achieve. So my go-to product is definitely Glow, because I love what it can do, and here you can see what it does. And this is something that is also, since I don't know, maybe 2 years, patients are coming to me and talking about collagen, as if they are just like new to this. But we sometimes, even as a doctor, we forget that hyaluronic acid is also a biostimulator, that collagen is always induced if you have a skin and wound healing. So this is something that is really, really common and normal. But if you also have a product that can prove it, that we have an increase of the collagen inside of the skin after injecting it, that we have a boost of the elastin that will help with the firmness of the skin, that we have a rise of the glucosaminoglucases, which are just like mainly responsible for the dermal matrix. And with the Glow, we have a depigmenting effect as well. So it's just like really something. It's sure, if you read this, you understand why I love this as a dermatologist, because it can address so many things. And I will show you a picture at the end of the presentation where you can see where I only did that with a male patient to reduce the pigmentation in his face, and in the end he had like a Botox and lifted effect on the face. The lift is also something that is really good because you can use it for so many things, and what I really like about the product is the elevation of the skin microcirculation, because this is also something that you can get sure by doing the microneedling, but alone it's not really something that stays long for this effect. And here you have really, really good results, and the best thing that is also really you have a satisfaction from our side as an injector, but you also have a satisfaction from the side of the patient. And this is something that is really, really good. But the shape is also some really underrated product, because even for me it was just like hard to put it somewhere in my assessment and what to address with it. But then I learned what it can do, other than diminishing or reducing maybe the fat tissue. It was also something that where we can say, hey, why not inject it with a patient who already has a lot of fillers in his face? Because then you can take away the puffiness, you can take away this kind of overfilled syndrome, and if you do that by injecting it a little bit deeper, you will have a better lymphatic drainage with it. If you use it superficially, you will have a nice skin relief activation. So it's something that really, really is also nice, and it can be used before you replace the filler, you can use it after the filler. So it's something that is not only used for reduction of the fat tissue. And what I like to do is this kind of thing that I call skin strengthening. So it's just like, because you have so many things inside of it, and maybe please raise your hand if I'm talking too fast. Because this is something I know, this is something I do with the patients every day, and so I tend to talk faster. So maybe I can slow it down a little bit, because you know that the skin booster range always has its kind of taxing with the hyaluronic acid, but you have the different kind of antioxidants which are inside of there, and you have the different kind of vitamins which are also there. And by this different kind of regimen, you have just like a better skin barrier. You have a resilience against the environmental factors, and you saw it by the perfect nice pictures of Dr. Rossi, how the improvement around the eye was. And even he said, okay, I don't know how it works, but sometimes it's not only the skin strengthening, sometimes it's just you start to inject it deeper, you don't have much of an effect. You start to inject it a little bit more higher, you start to have a different kind of effect. You have the puffiness reduced. Sometimes even with allergic patients, they come to me and tell me, now if I sometimes wake up in the mornings, I don't have this kind of pillow-like feeling anymore in my face. And so it's different in a way how you inject it and what you want to achieve by that. So sometimes I was a little bit hesitant to use too much of it, because before I was told maybe 0.1 per point and maximum like 0.6 per eye, but now I'm also exceeding that if the patient needs it. And this is what I also want to stress on, the assessment. So this is something that you cannot learn, you have to adapt it, and this is also the individualized treatment, and you can also layer it. You can use the Glow, you can use the shape in one session, no problem at all. And so that's why you have a different kind of options what you can do. For example, in the mid phase, if we want to address, for example, the marionette lines or the or the nasolabial folds, you usually use the hyaluronic acid, which was just like in a way in a higher cross-linking to have also an elevation effect in there, and also for the necklines. But you can address that also fine by using something that has no binding agent, no lifting capacity, no G prime, by putting them in a different kind of layer. And still, if you have a loss of volume, sure, you cannot do that with a cell booster. Then you use a filler or you use something else to bring that up. No? And you have different kind of techniques. You can use it either linear, you can use it a blanching technique, you can use it as a serial technique. The good thing about this, what I want to stress, is 3 messages for the cell booster. It's safe, it's efficient, and it delivers. So this is really something where you, even from the first injection on, you will have that, and if you use it more and more often, you will see it will also have a better effect. And this is what you also need to know, is that you need to do it at least 3 times. There are other different products on the market where you at least need to do it 6 times to have this kind of effect, and this is really important so that you can just do that. And if you use a nappage or papular technique, or if you mix it, in a way, it's open, but you need to know what you want to address. So if you want to address a contouring, you have to put it in a different kind of place in the face than rather if you want a volumization, and also if you want to reduce wrinkles around the eyes, for example. You saw that also in the pictures of Dr. De Rossi. It has just like a Botox-like effect because you just iron out these thin, small lines around the eyes without using any toxin or any kind of other filler there. But sure, for the volumes, you need different kind of products there. So these are, for example, small videos where you can just address, either you go linear inside of the line, or you go around the mouth area, or you just bevel it up and change the needle by going inside of the line of the nasolabial fold. First, maybe address the piriform, just go into the piriform space, use a little bit of a filler there, and then the rest you don't need to fill in the nasolabial fold. You can use different kind of things in there as well. Or you can just address it by using this kind of fern technique, which can also be used, in a way. And if you are more happy about devices, you can do that with a device as well. For example, the last video that is now showing is usually a pen, which I use for injection of a toxin, but because of the viscosity of the product, you can just put it in there, and then you can just say, okay, I want to address 0.1 or 0.5 or 0.2. So these are the measurements that you cannot use with your hand, and then you can just distribute it fine and evenly with 3 ml for the whole face. And you'll have the microleading effect, you will have the effect of the product that has been placed there. So in the end, it's always about how you address it and what you do in these lines. And so, for example, I will just go back, if it lets me go back. Because if you just, for example, do a linear way of filling these small fine lines up, because most of the patients are asking me, then what can I do about these smile lines? Sure, you can try a little bit of a toxin or different kind of things, or you can strengthen it around. But for example, this technique to bevel it up, to go in an angle of 90 degrees and then change the direction of the needle to strengthen that part in the nasolabial fold, you can have really nice results with that without using any kind of other complex filler in this area. So this is something that we need to think about. We can also achieve nice results with something that doesn't have much of the G prime. What I love is combination. So combination of energy-based devices, combination of fillers and cell booster, combination of PLLA. So the PLLA is something that is really, really good optimized treatment to fill the mid-phase and to also trigger more collagen synthesis by being a little bit more pro-inflammatory. And you can do that in one session. In that case, PLLA is the foundation, and the cell booster adds like the immediate and long-term effect of the skin. So you have just like something that is slowly building it up. And some patients are impatient. So sometimes I feel like, why are patients called patients? Because they're usually never patient. They are always impatient. And so we maybe should call them different. But this is something that I feel like, okay, this is just like, sometimes I think different. But this is something where you just need to see what we can do. For example, here, a nice result of a patient of mine. She came in and wanted to have the toxin done, and I told her, let's laser. I wanted to laser this face. I couldn't wait until I had my hands on this face to put the laser on, but she refused because she didn't want the downtime. And then I offered her the cell booster and said, okay, you know what? Let's go to town, and I give you a special price for that. Let's do this, but let me inject also the biostimulation. Let me do the thing because she's a heavy smoker. She goes sunbathing all the time and everything. And just after 2 months, she came back and told me, everyone noticed in my surroundings that I did something, but no one could place their finger on because it was so less visible. And I feel like she's still looking like herself, but like little bit of a better version of herself. Maybe less stress, maybe less smoking. She still has these lines, and she still comes up for treatments where I just inject her. And for example, here, this was the injection of the PLLA. So you go in the dermal subcutaneous layer and then place the product in there. I use a bigger cannula for this, and even for the PLLA, sometimes you have to even use bigger cannulas not to block them. And then you have to be just really sure that you are in the right plane, because if you inject the PLLA too superficial, it's trouble. But if you put then superficial the cell booster, it's really nice result. And you can see she even has some kind of lifting effect of the marionette lines, and even the smile lines have improved a lot. What I'm just addressing now are the perioral lines and also the lines around her eyes. So something what you can do really nicely. Other thing, radiesse or maybe calcium hydroxyapatite, something is, this is also en vogue again. There was a long time where you didn't do anything, but now it's just like what I do is that I have them both. So this is like my lifting composition, and then I ask the nurse to put it together, because before I used to do it differently, but now I said, why should I dilute the calcium hydroxyapatite and then put the other thing on top? Why not just mix it all together, and then I have a really good thing, and then I can go and inject it, and you have really nice results. It saves me a lot of time because I can just adapt that. I can put it with the cannula, and then it's done, and the rest. The magic is done just by that. This is a picture just like directly before, after. I know I'm a really bad photographer, so that's I'm happy that I'm a doctor, not working as a photographer. But here, for example, you can see that the pictures are really not nice. I know I have to learn that, but I'm onto it. And for example, here it's a little bit better. Here you can see that that after the injection of the calcium hydroxyapatite, the skin quality got better. Sure, I did also a little of a shaping around that area, but the skin is so much better, and you also see the reflection on the face. And this is something that is really worth it. On here, for example, with my male patient, I already showed these pictures, for example, at IMCAS, but this is something that I really like, and he came in and asking more for a masculine look. And I told him, you know what, let's do the calcium hydroxyapatite to make it a little bit more broader, more wider, more manly, but still you can see that he has the scars, that he has suffered of the acne. And then he came back 1 month later, and I was a little bit disappointed because I was hoping to see a better result. But then I said, you know what, let's do the cell booster on top of it, why not? And then we sprinkled that on top just like an icing on the cake, and you can see 2 months later the calcium hydroxyapatite kicked in and the cell booster, and you have really nice results with that. So it's really something, sometimes you have to be patient as a doctor as well. So to know what you can do, but this is what the products are able to deliver if you have enough time. And now he's due to another treatment, and I treated him just like last month. So, and for example, this again, here, again, the combination of lift and glow, different kind of depth. and you can see these small pigmentation issues that she had, the rednesses, and also just like you can see that even the marionette line, everything has improved by these two products, and I didn't use anything else on her. No? I wanted to do a thread lifting, but she refused. No? So sometimes I have different kind of ideas what to do with as a perfect recipe, but it's just problematic. No? And the other thing with the combination is just like the Morpheus, for example, or just like this radio frequency microneedling. Do that in one session, wait 15 minutes, check for the temperature, and then inject, for example, the shape if you want to have a reduced puffiness, or if you want to have a reduction of the small wrinkles, or maybe scars. Use the lift, and this is just like perfect. And this is what I was talking about earlier. So you can see the pigmentation around the eye, and also these small fine wrinkles around the eye. They have so much improved after just injecting the Glow 3 times with 2 weeks interval. And this is really a nice result. And you can see the skin has so much improved. And this is what I feel like this is definitely worth trying it out. So I will say, let's try to use these products also in mid-face areas, and if you have any questions, I'm here for you. And now I'm happy to present my fellow colleague, Dr. Nenad Stankovic.
Hello. So, I don't know if do I have 5 minutes or 20? So, because this guy, he was really interesting, but he took like a little bit of my time. Anyhow, thank you. This is me, okay? So I was in a hotel and I was thinking about looking at this picture. This is just like the first slide that the company sent to me. And I was looking at both screens on my laptop. And I was like, oh my God, what am I going to talk this time? Because, traveling all around the world, speaking about generally the same stuff, you need to be like a little bit creative to gain the attention of the public. Because I was on one of the lectures, and the guy came and he said, I'm a plastic surgeon, I don't do this, but they paid me, and let me show you the presentation. And the presentation was actually the one from the company that they sent to all the doctors when they introduced the product. This is the product that has 6 milligrams of hyaluronic acid and some vitamins, and that's it, right? No engagement. So I was thinking, what I'm going to do, and I was like looking like that, right? And then I was like, oh, I have such a creative block, and I wanted to keep my face in the the same table I was on, and I felt like there's nothing in my head, just like nothing. And I was, when you actually do, when you're bored, you get your phone, and you click. And I clicked on my camera, and I saw myself in a front-face camera. I was like, oh my God, I don't look so well, right? Because the problem is, when you look at yourself at the front camera, the problem is that camera is like those curved mirrors in a fun house. You got actually a distorted image, and that way you have your nose that is a little bit bigger, the eyes a little smaller, and everything is changed. And then, of course, because you look at yourself like this, right? You have the different angle that actually nobody here looks at me that way. So you don't see me this way, but I saw myself. And actually, this is the real thing. This is called the Zoom dysmorphia, because the people, specifically in the period in the COVID, and of course after that, they were sitting at their laptops, facing down, speaking to other people, and then they will look at I have some here, the wrinkles, I have the double chin, and I need to see a doctor. And a spectacle one, right? A good one. Like, Timur. And they were thinking, I need to do this because this is something that is going to change my life, because and online people are looking at me, and this was actually published in the International Journal of Women's Dermatology, because the people are actually identifying these problems as actually real, both by the injectors themselves and the people that actually were coming. And they were coming to the patient because they needed to look much better as during the consultation, they're selling something, they're selling at least the ideas, and they need to look the best. They're thinking about their eyes, their face, possibly on the chin as well. And then actually, that created their need to go to a doctor to actually be filled by fillers, treated by lasers, and of course injectables such as cell boosters. And while I was looking at myself, I was like, oh my God, I have a huge double chin. And is there something that I can do it to myself? Of course there is. So there is something that is called the double chain injecting. Of course it's a lipolysis here because it's easier to follow up. But actually, when we inject the cell booster shape, it's not really the injectable lipolysis that we are accustomed when actually we use the sodium deoxycholate inside, because this product is different. There is a study that actually followed the sodium deoxycholate treatment on the people itself, and they found out that there is the inflammation, the necrosis, the destruction of the adipocyte cells itself, and that's of course very painful, and you have a lot of edema, but at the end what you don't have is actually the real stimulation of the metabolism inside of the body. And this is where actually the shape comes in. This was taken by my son. He's 13 years old, already looking forward to be creative. And we, when injecting the cell booster shape, we're actually increasing the usage of the accumulated fatty acids inside the fatty cell by the mitochondria, and they are going to use the fatty acid, convert it to the energy, and that way the adipocyte is going to become smaller, and what we're going to see is actually less volume in the areas where we need it to do. So we can do the double chin, and of course the jowls are something that can be injected as well, because we have the problem as that. As you already heard, the cell booster is a medical device. You can put this nice little tag inside of your patient's documents, injecting it completely legally, and this is something that I really, really like about. And in today's society, it is unbelievable that somebody can go, on the street and in the office and then say, okay, we have this topical use product, and of course it's there, you can inject it. No, it's not legal. But injecting cell booster is legal because it is a medical device product. So when we inject it into the double chin, we have the results that are very nice. I'm speaking about the lower part of the face, but now I'm currently doing a lot of people with the area of the malar fat pad, and injecting there as well gives them really, really good results as well. But then I said, oh my God, I have something else. I have these jowls here. I look like this cute little dog, but something that I would definitely need to do. And of course, the reason why we have jowls is the reason because here, when we see, this is skin reflected and then lifting up, and then there we have on the distal part we see a lot of fatty tissue, but in the area in the medial part there's almost no fatty tissue on top of musculus depressor anguloris. And the problem is that between the platysma, and this is the platysma, this medial part is actually completely like sewn through to the bone by the mandibular ligament. And then what you have, it is not going to move. And actually the platysma, it is completely moving in this part, but when you move it, you know, to the medial, it is going to stay up to here because this is completely movable part. But the another thing that is very important, the platysma, it is completely in connection with the upper part of the SMUS. So whenever you do a lifting in this area, you always have to do it first in the upper and the middle part, because that is going to reposition the soft tissue, and you're going to have a beautiful result. If you want to see this video on the YouTube, you can scan this QR code, and it will you know, send you to this video. So whenever we want to do the treatment of the jowls, the first thing is to remove the complete, or at least as far as possible, the fatty tissue accumulated there. And then, of course, this is for the usage of the shape. The difference, when we use the shape, we also, if we inject it inside of the fatty tissue, it will decrease the volume, but if we inject it inside of the skin, it is going to improve the quality of the skin. Whenever the patients would come and say, I would like to do a nice jawline with fillers, I would say, yes, no problem, it's a good indication. But if a patient comes with jowls, I would say, listen, if I would take a good belt and I put it on my belly and I just like strangle it really hard, somewhere the fat is gonna be seen, right? So if I don't take away your fat, the filler itself will not make it. So I have to do it. And that's why I do with CELLBOOSTER shape. I inject here, and then I completely remove the jowls, of course, increasing the quality of the skin. And these are the results that I get. And you can see the line that formed before was broken, and now we have almost straight line. And this is also with this patient as well with this patient. So actually creating a much better area and none of those patients actually being injected with fillers. So they wanted fillers. I said, no, you're not a good indication for fillers. We need to increase the quality of the skin. We need to remove that fat. And actually, very important thing why I have chosen to inject CELLBOOSTER shape is because it gives result, it doesn't hurt, and no swelling or very little. Because if I inject something based on sodium deoxycholate, it is going to be a lot of pain, of course not legal, and then the problem of the swelling that the patient don't like. And of course, if we have injected this, there's a lot of lymphatic drainage. But we always have, after we inject the shape in the areas of the removing the underlying fat, we have to increase the quality of the skin, and for this we're going to use specifically CELLBOOSTER Lift that gives a good redensification of the skin, because it gives the necessary nutrition to the skin, the hyaluronic acid, it gives the hydration to the skin, and that will improve the collagen and the hyaluronic acid inside. So this is going to improve what we see. But once again, when I do the workshops, you know, the doctors will say, hey, I'm using the other product. They all have the hyaluronic acid inside. They already have some vitamins and minerals inside, and it's just the same. Of course, saying it's the same, it's a complete misconception, because the product that as like a CELLBOOSTER, it's different in making. It's actually for you to understand that having this product, it's having a revitalization product that actually has the prolonged, this is like a prolonged, the giving of the product. This is like, you know, you take the some medicine that actually you need to take like every like 3 or 4 hours, but then you have the other one that is actually the extended release. So I see the Cell Booster, like a full range, as an extended release product. So actually for the period of 2 to 3 weeks, the product is going to release all of the gathered active ingredients for the hyaluronic acid, and that is going to give you the best results. Improving the quality of the lower face depends on the indication, and of course, at what stage does the patient comes, because we have the no sagging, then just like lift will just prevent, this is like rejuvenation. So if you have a very young patient coming to your office, and you say, oh, you don't need filler, you don't need botulinum toxin, but yes, you can inject the Cell Booster lift because this is like preventing the aging. So very good. Then for the mild sagging, the lift will increase the quality of the skin and push it up. Then you can also put a little bit of hyaluronic acid filler in there. But then at the number 2 and 3, you have the jowling. So you have falling down of the underlying fatty tissue. In this case, you should use the Cell Booster shape for diminishing the volume of the jowls, a Cell Booster lift for increasing the quality of the skin, and of course some of the filler either for the jawline or for the middle part in this area. So in this patient, what I did, actually I was doing the jawline. I used Apriline Forte. I've put the filler in with the cannula to the chin, then in the jawline itself, and then to the gonial angle and to the ramus of the mandibula, and you can see actually the result afterwards. She looks like really tensed up, like she was working out, and the results are really, really great. Of course, I have chosen for myself to do the treatment with the Apriline Forte as well, and you can see I look much better. Thank you so much.